Hi everyone, Dr. DePorter here, and I'm the dentist at Mountain Ridge Dentistry. I have seen so many more people coming in with symptoms of clenching and grinding. Now, this clenching and grinding can cause a lot of serious problems. It can cause anything from chipping of teeth, tooth pain just to chew on them, hypersensitivity, jaw pain, generally just discomfort in your mouth. Ever since we came back from the quarantine, I have dubbed what I'm calling the COVID clench, or the pandemic clench. Whatever you would like to call it, but I've seen it far more frequently in all of my patients. And a lot of them are not even aware they're doing it. With this, we just want to make sure that we are aware of our clenching and grinding habits. So what we need to do is just pay more attention. Keep it at the back of your mind, especially during the day. When people tend to do it during the day, they're focusing or they're stressed out about what they're doing. Also, people tend to do it at night. Now that's a very difficult thing to stop because you're doing it subconsciously. At that point, we need to talk about wearing a mouth guard at night. Most of the time, the symptoms of if you're doing it at night are you wake up with a sore jaw or pain in your teeth, things like that. Now, if you don't think you're clenching, I strongly encourage you to keep it in the back of your mind. Be aware of your signs and symptoms, tooth pain, jaw pain, waking up with a sore jaw, things like that. I just want everyone to be aware of these things because that's the best way to stop any other damage to your teeth. Now, if you do find that you are clenching and grinding, we need to either get you a night guard or at least get into having an assessment and adjustment on your teeth to equilibrate that bite, just to make sure that there's no reason to increase your clenching and grinding habit. We do find that some people, no matter what they do, they still want to clench and grind. At which point, then we might need to think about wearing a potential guard during the day, or again, just being more cognizant of that habit. I'll tell you my story about clenching and grinding. Long time ago, I was talking to my dentist, and I've been having sensitivity, just cold sensitivity generally on my teeth, and I just didn't know why it was happening. I was trying some anti-sensitivity toothpaste and it still kept happening. Sure enough, he's like, it kind of looks like you might be clenching or grinding your teeth. And that seemed very strange to me because at the time I had no idea I was even doing it. I had no idea that it was even something that I could do subconsciously. After my dentist asked me to just pay attention a little bit more during the day, I find myself doing it almost every day. Whenever I'm focused on what I'm doing, what I do is I clench my jaw together. I don't know why I do it, but I do it. Since I've been more aware of it, my sensitivity has gone down and my teeth feel generally better. All right, to sum up, I've been seeing a lot more clenching and grinding on all of my patients. I want you to be aware of yourself during the day. I want you to pay attention for any signs and symptoms you have of clenching and grinding. Thank you so much for watching. I'll see you next time. What do you think? You all right?
You did great.